Namaste all. Today we are in a session with Dr. Hemamalini Madam from Rajahmundry. Our program today is Moms to Be, how to support them and how they can be guided through these sessions. Those who want to be intuitively connected to the souls, the incoming souls, and receive the guidance from different masters. And today we have Hemamalini Madam, who has taken a session earlier, and today she's again with us. And she has graciously agreed to take another session with us. So, just small introduction about Hemamalini Madam. She is a doctor from Rajahmundry. She has done her MBBS and PG diploma in adolescent health. And she's a medical officer also. And she's now retired, but she's conducting different workshops for adolescents and women. She's practicing yoga and meditation from 2004. She's a singer and a dancer too. And she's actively participating in health awareness programs and counseling, spiritual and social service activities. She's conducting various workshops in meditation and motivational classes for students. So, with all the blessings of all the masters, let us all welcome Hemamalini Madam to this session to guide us for this moms to be, whoever wants to be connected to this. Let us pray they all get connected intuitively to these sessions and gain the knowledge and reach out to Madam whenever they need further clarification or help. Thank you, Madam. Over to you, Madam.
Yes. So, good morning, everyone. Good morning, all the moms here. And let us start the session. Previously, also I have taken one session regarding the care during pregnancy, what care you have to take, and how you have to prepare yourself to be
Madam,
become
excuse
pregnant.
me, Madam. Can
Yeah,
you be a
yeah,
little louder, Madam? కొంచెం
yeah.
గట్టిగా.
Ah,
Oh,
yes, yes. One minute. Is it okay now?
మీ హెడ్ కట్ అయిపోతుంది కొంచెం.
Cut. If I go farther, no, no, yeah. Is
Yeah,
it okay?
it's perfect, Madam.
Is it audible also now?
Yeah, yeah.
Okay, okay. Yeah, previously I have taken one session with you. I have conducted one session, and in that I have told you how to you have to prepare yourselves to become pregnant, and how you have to connect with the baby while you are pregnant, and what care you should take, and what nourishment you have to take, and what type of thoughts you should have, and what to do and what not to do, and all these things roughly we have taken one introductory session. And today, as we progress in the pregnancy and we approach the delivery time, mostly we plan to have a normal delivery. Why? Because natural things happen very in a natural way, and the healing will be very good, and it is very good for the mother and also the baby. So I always tell the mothers to talk to the baby, to have a conversation and communication with the baby, along with the father to be also, and tell the baby and communicate with the baby to have a normal delivery, to cooperate with the mother, and I will be with you, and let us have that natural pathway, to have that natural path and natural way to have the delivery and all. Why? Because the vaginal contractions, when they have those contractions, no, it gives good massage to the baby. Why do we prefer natural delivery? Normal delivery means, though it is painful, why we prefer that means that natural massage is very good for the baby. All the parts of the baby will pass through the vaginal canal, and while the uterus contracts and the vagina and the cervix, when they contract, no, they give good massage to the baby, to the all the parts, and from that contact is very good, and that passage also will be slow and gradual and graduated, so it won't have any sharp suddenly. If c-section means you will take out the baby suddenly, that will not happen. Slowly the baby will descend and passes through that vaginal passage and gets the good massage, and also the secretions there, the vaginal discharges that are present there, they give good immunity to the baby. That coating to the skin of the baby, that gives good immunity and like acts like a good vaccination, almost for 1 year or 5 years, even more than that period also. The good immunity the baby will get, like breastfeeding, no, like that only. Even if he doesn't get vaccinated also, it gives good protection to the baby. So we prefer to have that vaginal delivery, that's why. Okay, so when it comes to the delivery part, after the delivery, the immediate period after childbirth is called the postpartum period or postnatal period. We are talking about the after the delivery time, how you have to take the care and how you have to get prepared for the events that happen after delivery. So this period is called postpartum period. Postpartum period usually lasts for 6 to 8 weeks, that is 1.5 months to 2 months. During this period, the body and the mind, emotional and physically also, the mother gets that repair time, no, so she can come back to the normalcy. For that time, it takes for that it takes 6 to 8 weeks of time normally. Usually after 3 months she should be normal, back to normalcy, as before pregnancy time, no, how she will be like that only. Actually, the first 24 hours after delivery is very crucial. It is called the acute phase, during which we have to observe for the any temperature, rise of temperature is there, any fever is there, any infection is there, any chills are there, or any fits are coming to the mother. All these things, and blood pressure and vitals, pulse rate, heart rate, and everything they have to check. And certain times if you get any infection, no, you will have that fever. And about the perineal wounds also, if it is normal delivery, they put some stitches, no, to widen the vaginal pathway. They will just cut episiotomy, they say, and they apply some sutures, so that that will be very raw and sore. That perineum area will be very raw and sore. How it will be, and it will be very painful, and it will be sore, and it will be swollen sometimes. It will be very painful, and also sometimes you will have a sudden extra, I mean, abnormal bleeding also. Then also you have to report to your doctor or the health provider. That sudden extra over bleeding should not be there, and passing of any clots, any over bleeding, you have to report to the doctor. And any fever or anything abnormal, any abnormal discharge, and you will have vaginal discharge, that is a bleeding with some serous fluid mixed with that, that is called postpartum vaginal bleeding, is called lochia. That will last for, it also is unique for each and every individual. It varies from person to person. It usually lasts for 2 to 3 weeks or 4 weeks, or for some people it will be for 5 weeks also. A little bit of bleeding will be there, straw colored sometimes. So it will last like that. And after that, after 24 hours, what happens? The bleeding is regulated, and the soreness will be a bit less, and you will have some constipation also, because you won't be eating much, no. Initially you can't take much of food, normal food. You can take the solids. So only liquids you may take, or some coffee or milk or tea, or some semi-solid fluids, or some kanji they will give. So you will take only that little amount of food only. So you will have that constipation problem, and also because of the perineal stitches and perineal soreness and that painfulness, no, you won't try to defecate, so you will have that constipation also. Slowly all these things get adjusted. Your physical level, you have to come to your normalcy, and all these wounds they have to heal. The stitches they take about say 7 days to 2 weeks to heal completely. And they will apply some ointment, and they will give some hot fermentation or some infrared light they will put, so that it heals so quickly, and you will have that comfort. And the hygiene also I have to maintain normally, because bleeding will be there, no, so there will be all chances to get infected. So if the discharge or vaginal discharge is foul smelling or anything like that, itching or some pain swelling is there, means you have to report to your doctor. And after 24 hours, usually immediately they will ask to breastfeed your child. You have to have the contact with the baby. uh, we advise immediately they will give you the baby into your hands and ask you to hold, and they will put you on your chest, just like that before washing also, because that contact, that communication with the baby is very very important. That for that bondage to the mother and the baby, that contact is very important. And as soon as possible, we advise the mother to try to give the feeds to the baby. First itself, you won't get that milk discharge and all. It takes at least 24 to 48 hours to get that lactation, that is to breastfeed your child. That milk discharge will come only after that. But immediately after delivery, because the hormones, the estrogen and progesterone will be very high during pregnancy, suddenly after the delivery, when the that purpose is served, no, and the baby is out, suddenly those hormones also they will come down suddenly. And this for lactation, the lactating hormones will be secreted. So, with that stimulus, what happens is some straw like straw colored, just yellowish liquid, a few drops only they will come from the nipple. That discharge will come. That is very, very, very important. It contains all the immunoglobulins, and it gives the highest immunity to the baby. It protects from all the diseases, not only during childhood, not only during infancy, even if the baby becomes adult also, no, that colostrum when which you give to the baby will protect her throughout the her journey, life journey. So that is very very important. So you have to give that colostrum to the baby. Few drops of that yellow straw colored, it will be a bit sticky. That has to be given. Actually the doctor and the nurses they advise you to give, but you feel it will be painful only for the first time. That too for the first child, first conception. The nipples will be very sore. You don't feel like feeding, but that bondage should be there. You have to take and hug the baby, take to your chest, and try to feed her, and try to talk to and communicate with the baby. Then only that bondage will develop. And you have to give that colostrum in the first 24 hours of the birth. And after that, after 24 hours, the breasts will increase in size because they will be full of milk. So they will be engorged. The veins will be prominent. It will be very painful. You feel heavy, and sometimes you will have that slight rise of temperature, fever also because of this swollen breast, no, you will have that. And you will have that sore nipples. So some application of creams and all you have to take with the advice of the doctor. And what happens is, as you feed the baby, the soreness will go away. We think that it will be it is hurting and it is very sore, I cannot give, and I should not give, I let me wait for some time. You should not do like that. You have to feed, even if it is sore, even if it is painful. Once you start feeding, no, then only will get relieved of that pain, that engorgement and all. The milk will be excreted, and the baby will be satisfied, and given sufficient nutrition to the baby, and you will have that soreness also slowly coming down as you give. You have to feed from the both sides of the breast, not only from one side. So some people, they have the retracted nipple. During pregnancy itself, the doctor should examine and tell you that. Usually they tell, if the nipple is retracted, that is goes inside, it's not protruding, so that the baby has to catch and suckle, no, but that it should be convenient. If it is retracted nipple, they will ask you to squeeze out and do some massage during pregnancy itself, so that when you deliver, no, the nipple comes out and it will be ready for the baby to put into the mouth and suckle. And for that also, for the first time, you won't be knowing how to hold the baby and how to feed the. Only some people, they what they do know it, that's why it hurts, and it gives rise to the soreness of the nipples. What they do, only nipple part they will put in the mouth of the baby. It's not like that. It's a complete areola, that pink part, no, around the nipple, the whole areola should go into the mouth. So your health provider will advise you properly, and you have to hold the baby comfortably. You should sit or lie down in a comfortable position, and then give the baby the feeds. This side, and also the right side and left side also equally you have to feed. Otherwise one side the milk will get clotted, and you will have lumps, and you will get fever and abscess, and everything, infection will come. So both sides you have to feed. If one side, if there is a problem also, if there is some retracted nipple or something like that, you have to tell your doctor. Sometimes they give the breast pump, so that it will be pulled out, the nipple will be pulled out, and enable the baby to take the feeds normally. So as far as possible, you have to breastfeed your child, unless you have any serious medical issue or medical problem. We advise the mother to give the feeds to the baby as long as possible. As long as the mother gets the milk, no, at least for a minimum of 6 months, you have to feed the baby. Then only the baby will be very healthy, and immunologically also the baby will be very strong. So the nipples and breastfeeding, and also the vaginal bleeding, you will have that lochia will have. You should have that healthy discharge, and there should not be any abnormal or over bleeding should not be there. And also your uterus comes to up to this level, no. For 9 months it will be almost to the sternum level. So for that uterus to go back to its original size and shape, it is called revolution of again the uterus. So for it to come back to its size, it takes 2 to 3 months of time. So if you give breastfeed the baby also, the uterus comes to normal size quickly. So for that also we advise to breastfeed your child. While coming back to its normal size, the uterus, it contracts and comes down to its normal size. While contracting, you will experience some vaginal, pain, and also cramps, abdominal cramps, because it is contracting, so you will experience that cramps. So you can have some heart fermentation or some mild paracetamol tablets or something to combat that pain in the abdomen. And normal diet you have to take, nutritious diet, and no restrictions whatsoever, because you will be given antibiotics for that healing. So you need not have restricted food, or these foods should not be taken like that. Dal and all usually they don't give you, because you will get sepsis and you will get pus like that. Elders say like that, but you need not have those restrictions. You can eat all whatever normal diet you take, and you should take high protein diet and iron rich diet and calcium rich diet, because the baby is taking the milk, milk contains, as you know, the lot of calcium. So the mother is depleted of all these vitamins and also calcium, so she has to supplement herself with lot of calcium rich foods like milk. They will be given, no, lot of lota the milk they ask the mother to drink, because you are feeding the baby, so you should take. And moringa leaves, they are very good in source of calcium, and for breastfeeding also it's very good. And papaya, raw papaya curry they will give, and a lot of vegetables, leafy vegetables, spinach. All these things are rich in calcium and iron, and they are good for this milk production also. So you have to take all those foods, and you should have some walking around the room, and you should not sit idle and take complete bed rest. You have to move about, so that you will come to your normal weight, and the uterus also comes to its normal size quickly, and it's good for your weight management also, because you will put on weight, no, because of the amniotic fluid, and size of the uterus, size of and weight of the baby, and also placenta. All these things put together, it will put on some weight because of the hormones also. As they come to normalcy, you also should take normal physical exercise and try to come back to your normal weight, and also the normal health as before, as you are in the non-pregnant state of thing. So you should plan for that also. If you put on weight now, later on you will have backache and all those issues. So you have to maintain a healthy weight. You should not become underweight also. You should eat properly and do normal exercise, physical exercise, and you will have fall of hair also, because of the you are lactating, no, you will be losing iron and calcium. So you have to take those supplements also, mostly due in the form of diet only. If necessary, the doctor will give you supplements in the form of tablets or tonics. You have to take them also. And what else? And
Ma'am, do
that
I have to
bondage
tie
is
the
very.
stomach? Like they will say, like they use belt or something to tie around, like cloth.
You
Um,
can wear, but it's need not be very tight, so that
mm,
you will have an upper abdomen and a demarcation and a lower abdomen. You should not be like this. You should be
mm.
flat, no, as far as possible. As far as possible to the normalcy you should come back to. You can wear a belt, and even if it is for Caesar also, you can take the advice of the doctor and you can wear a belt to a comfortable level. Not too much of tightness should not be there. You have to wear that. And as you breastfeed, no, the uterus comes back to its normal position, and you should do some normal physical exercise, and you have to move around, and you should not take complete rest, and you should take the support of your parents or in-laws or husband or whoever, sisters or brothers or whoever they are with you. You have to take their support for physical thing, emotional thing, and also to handle the baby also. You are not experienced, no, they are experienced. They will be giving their advice, piece of advice, and you consult your doctor also, and correlate both of them and follow the advice. Like that it should be. Regarding diet or moral support or physical support or emotional support, everything the husband and parents or in-laws they should give from the family. Otherwise, what happens usually, we are not prepared for the newcomer, no. As long as the baby is inside, we are taking care of. Yeah, we know that we are going to become a mother. We eagerly wait for the baby. It's okay, but once the baby comes out, means you have to handle physically outside. Another being will be there with you. You have to attend all the 24 hours. It is not like that. It's not a part of you now. It's outside. You have to take care of the feeding and bathing, cleaning, everything, toilet, everything you have to attend to. And the baby will be crying in odd times. You will not have proper sleep. It will cry in the night time only. When you are about to sleep only, they will start crying. No, they won't allow you to take food also. At that time only they will cry for you. And all these things happen. And they will have their own health issues. Fever or some mild jaundice is very common because the liver is not completely matured in the child. So some jaundice is very common. You need not worry about it. And they will tell you to take the baby and apply some oil and expose to the sunlight. Or if the sunlight is not there, means they will put in the boxes where the ultraviolet and infrared rays are focused, and so that the child will get that, and the jaundice will go away. That is a normal part of a normal jaundice. Sometimes what happens means mother will have that blood incompatibility, Rh positive and Rh negative type will be there, no? A B C A B A B A B A B O, and in that also rhesus factor will be there, Rh positive and Rh negative. If the mother is Rh negative blood and the baby happens to be in Rh positive, means sensitization happens through the umbilical cord and placenta. The bloods, no, they get mix up, and the baby will have a severe jaundice. For that also it is treatable, and some immunoglobulins will be given for that also. When you are aware of that you are Rh negative, you will be prepared, and doctors also are prepared to treat the mother and child. Usually the sensitization happens during the second childbirth, not in the first thing. First child will be okay usually. So all these things are normal. Are normal. Sometimes you will have premature delivery. The baby birth weight will be very low. You have to take extra care and all. And immunization also. Immediately after the birth, they will start vaccinating the baby, and they will have fever, swelling, all these tantrums will happen. So you have to take care of that also, child also, and take care of yourself also, your health and your nutrition, your rest, physical rest and mental rest also, and emotional preparation also. For that also you have to prepare yourself from the period of pregnancy itself. So the child will come. These are the responsibilities of mine, and I have to share my responsibility and the child's responsibility with the family. You have to educate them, and they also should understand and give full support to the mother. Then only she will cope up with the situation. Otherwise what happens, she will suddenly go into depression, anxiety, sleeplessness, and this is called postpartum crisis and postpartum depression they will go to. It's again a medically serious issue. Usually they call this baby blues. Initially for the first 1 week you will be confused. You are not accustomed to this type of responsibility, and take care of one human being, another soul to bring up, and you are the whole person wholly responsible for that baby's outcome. So you will feel overwhelmed, you know. So that type of some disturbance, emotional anxiety, sleeplessness and apprehension will be there. They are common. They'll ask for say maximum 1 week to 10 days. Otherwise after that we will get accustomed to, and with the support of the family we will overcome that. Slowly we will overcome that. That is quite normal, especially for the first pregnancy and delivery it happens. But in some cases, no, it continues, the anxiety continues, and that mood swings will be there because of the hormonal thing. And if the mother has already some any psychological or psychiatric problems or issues, means they will definitely get respirated, and it is expected for them to have this anxiety and depression. For that they have to take the medical advice. Sometimes the counseling will do, sometimes the support of the family will do, sometimes both are needed. Sometimes in some, instead of that you have to take in addition some medications also, which are safe, for the baby also, because they will be breastfeeding. No, you will be having doubt whether I can take psychiatric tablets or psychotic tablets. If I take, no, what will happen to the baby? Baby is also taking the milk from me. nothing will happen. They are safe only. With the advice of the doctor only, psychiatric consultation will be given. So sometimes psychological counseling will do. So with that will come out. Otherwise, it will go to the extent of committing suicides also. To that extent, the depression may come to. So sometimes they will try to kill themselves and their life. They cannot handle the situation. That's why they will think they are unworthy and they will blame themselves. I'm not a worthy mother like that. Like that, their thoughts will go on and the anxiety increases and suicidal thoughts will come. Sometimes they will try to kill the baby also. That also happens. So you have to be very careful, and the family members support is very very crucial and important. Because of this only you have to observe the mother and the baby, and about their bondage also. Sometimes if the mother is not able to handle the baby, means you have to temporarily the mother or somebody else should handle the baby, and when the mother is ready, just hand it over to the mother, and they have to tell the importance of that bondage and importance of this breastfeeding. Automatically that motherliness comes out, and this anxiety everything will go away. Sometimes the anxiety and these depression, these feelings, they dominate. So in that case they need medical advice and supervision, and also the medications also sometimes. So baby blues are normal, but postpartum depression is not normal. So that is also you have to expect. Sometimes they will have high BP during pregnancy. In those cases, immediately after delivery, they may go into fits, and sometimes the baby may be born with some abnormalities, unexpected things, underweight or any serious health issues or mental retardation or genetic problems, means mother cannot take it. So in that case also mother goes into depression. So she needs emotional and moral and physical and everything whatnot, every support from the family and also the friends and the doctor also. You have to tell them and take the proper advice. So this is all about the postpartum period, and after 2 to 3 months the uterus comes back to its normal size, and after that you may get your normal periods. During lactation usually you won't menstruate, you don't get your periods. So that is the one way of having that family planning also. As long as you lactate, no, usually you don't get your ovulation and your regular periods you won't get. So you can happily spend your give your complete time to your baby and have a good time also. So that is about the postpartum period. And yeah, you have to slowly do some yoga and some exercises, so that sometimes no, for cesarean section they will give spinal anesthesia, will have backache and weak spine. You should not have. You have to, while sitting also you have to maintain our posture, otherwise also that slouching will come. That should not happen. And have to take good nutritious food and have proper exercise and all. So that is about postpartum period. And any doubts if you have regarding this, you can ask me. And come across in my practice also. When I'm talking about depression, sometimes, many times, you will have this abortion, no, miscarriages will have. At that time also, you will go into severe depression, because you are expecting a baby with lots of hopes and all. Suddenly you lose the baby, maybe in the very early pregnancy. It will be, sometimes you can cope up with the situation. Sometimes it happens in the second trimester, that is after 6th month, 7th month, when the baby is fully almost formed. At that time, if it happens miscarriage, you cannot handle it. It's not so easy to come out of the depression. So then also the family support should be there, and the husband support should be there, and you should not think why it only happens to me and all, and you should not go into depression. You should find out the reason why it has happened, and you should take the doctor's advice. And second time, you have to plan carefully, take the doctor's advice. If they want you to take some gap, and if you have to correct your any physical or medical situations or medical conditions, so that you are not suitable for the pregnancy, means you have to wait, take the doctor's advice, so that you should have a full term pregnancy and a normal child. No, anyway, somehow or other I should have a baby, whether it is having any abnormality or anything like that also it's okay, means it's not like that. No, we should have a normal and healthy mother and also a healthy baby and child. No, so a happy family should be there. So accordingly you have to plan and take the doctor's advice. Medicine is advanced nowadays so much. No, so for everything there is a way, and there is a treatment, and there is advice to be given and to be followed. So we have to follow those advices and take proper decision. And for that also the husband's support also should be there, and only that mother will understand that pain. So they have to bring her out of that situation. It will be very difficult, I know. I've seen many patients also, and I, as a spiritual person also, I should tell one thing also, one more thing. Sometimes we curse ourselves. Why it is happening to me? I am a cursed one. I am not a blessed one. I should have done something wrong. But I am a good person only. Why it happened only to me? Like that we think. We go into depression. So this may not happen in this life. We have our previous births also, and these karmic issues will carry. Maybe in your previous birth you may be having, you might have had lots of children and got fed up with the with their thing, no, bringing up and all. You might have thought that Chichi, this birth I had these much of children, next birth I should not have any issues, so I should be a free bird, like that. You might have wished for that. That wish will be completed, no, in this birth. You will forget about that. That may be the issue. Or you were a poor man or a woman in the previous birth, and you could not raise your children. So that also, at that time also, you might have prayed God to have all riches, not these children, and not these botherations. You might have wished for that. That also wish also will be fulfilled in this birth. So all these things you have to think about the karmic issues. And sometimes these miscarriages and all, if you are a mother-in-law in your previous birth or anything like that, you might have done something wrong to your daughter-in-law to get her child aborted or something like that. Or you might have helped someone to have that abortion or something like that. That also it will carry on to this birth, and you will have that. So you have in that case also you should not curse yourself. So I have done that mistake in this those previous births, that's why I'm cursed like this. You should not think like that. You have to realize, and you should have that knowledge, and you should have that awareness and understanding of why this should have happened. You should think it over, and you should understand the situation. This might be the reason, and accept that. And if at all there is any mistake from my side, you ask for the forgiveness. You ask them, say sorry to them. You need not know them, just in your thoughts say, to whomever I have done this bad thing, to whomever it is, I am asking them to forgive me, so that this karma will end here itself, and it will be cancelled. Once you ask for that forgiveness, and once you forgive also whomever whoever is doing any harmful things to you, you have to forgive them also in this birth also. So all these karmic things will have connection. So that's why for no mistake of ours, we'll have certain difficulties in our life, not only about pregnancy and childbirth, in other aspects of life also, regarding our job or relationships or marriage or wealth or anything. If you are lacking in something, means something must be there in the previous karma that is being carried out here. So we have to understand and accept it, and you should not repeat that mistake once again. And here also we have to help others, whoever is eager to conceive, or whoever is pregnant, whoever is undergoing delivery. Go and help them, give them support. So that will be a blessing for you. So God will listen to your prayers and bless you. That will happen. That will happen. Practically, it happens. I have seen. That's why I'm telling you. So all these things will be there, and I think you must be knowing that I need not tell. I think the gender of the baby also is dependent on the husband only, not on the wife. So nobody should blame why you're having only girl babies. You are at fault. You should not say, because the XY chromosomes, the Y chromosome is responsible for the male baby. So it is carried in the husband, male partner. So he is to be blamed, not the wife. That also should be understood.
Ma'am, my sister-in-law, she gave birth to twins, but she didn't have a milk at all. Like she got some medicines also to produce milk, but it didn't happen. Like why would that happen? Like usually that is a natural process, right? Why somebody
Natural
will?
process only, but some that hormone connection, no, that maybe it's lacking in her. Twins
Oh,
means you should have actually, because the
yeah, she
um,
didn't. She didn't get not no
immediately you
signs
have to
of
take.
any breast change in her at all. We were so surprised.
Okay,
Like,
okay.
yeah.
During pregnancy itself, the doctor should have recognized that and should have given some medicines also. Some herbs are there, Ayurvedic medicines are there, very good medicines. Lactare
Oh,
and all these, what they call, I forgot its name. They are very lactogenic. Those
oh,
medicines will be given to be mixed in the milk and to be given to the mother during pregnancy itself,
oh,
so that she will have that the vessels, the channels in the
can,
milk
mm-mm.
channels will be engaged, and they will be filled with the milk. They will
Oh,
be ready to secrete and matter.
mm,
Should have noticed during pregnancy itself.
mm.
Now, how old are they? They
The
have
babies
grown.
are now just turned 1 year, but
Oh,
no, they didn't get any mother milk. Not,
oh,
mm,
arre.
mm.
It's a
We
rare
didn't
thing to
know
be.
that time, like, yeah, no.
There are medicines, and
Uh,
that's why they give you this
See,
dondakaya.
after birth, her doctor put her on some milk producing medication. Even then, it didn't happen. Then she
Oh,
said, like, no, we tried our best. No,
okay. Artificial, yeah, this milk
mm,
formulas they matter.
formula.
Even then, she need not feel sorry. Let
Uh,
her love flow.
yeah, yeah, yeah. Yeah.
That is more than enough.
Mm. But they grew up healthy now, 1 year old, right? So
Good.
yeah,
Yeah.
all good. Yeah, they transitioned to solids and all good now. Yeah.
Both are
So,
healthy.
yeah, both are healthy. One baby was bigger than other baby.
Okay,
Uh,
okay. It
then
happens.
they caught up with the weight. Now both are same weight.
Yeah.
And when they were born, we were worried like why is one baby is so tiny and one is so big. But
Oh,
they are normal
oh,
now.
yeah.
Yeah. Yeah.
Once the food is given, no, then they will
Mm.
manage to have normal.
Mm.
Anything else?
And some babies cry a lot and we don't know the reason and they say like colic, right? Like they drink milk and then immediately when they burp, all the milk come out. They can't hold the
Yeah,
milk in the tummy.
because the size of the stomach will be very small
Very
for
small.
some babies. The digestive system, no, it won't develop much
Mm, mm,
for some babies, and for
mm.
some babies, the lungs also they won't get developed. No,
Oh.
if the for the premature babies and all. So
Mm,
in those
mm,
cases, it happens like that. You have to give little less only the feedings, and you have to do
mm.
this burping and all.
Burping. Mm.
Yeah. Yes. After some time, no, you can give that the hing. They say
Yeah,
inguva.
ingwa.
Inguva they will mix. They used to mix in the milk. The
Oh,
previous our grandmothers they used to give, so
for
that the
good
yeah
digestion.
milk for good digestion. And,
Oh,
after that, when they grew big, no, this vamu and all ajwain.
ajwain.
Again, we put in the milk and boil and then
Mm,
feed the baby so that they won't have any indigestion and normal motion they will pass. Otherwise, they will have
mm,
stomach ache and all these things.
mm.
And you have to introduce
Yeah.
all the food from the
Food.
childhood
Mm,
itself.
mm,
Otherwise, they will give eat all potato fries only
mm.
and sweets. It's not
Sweets.
like that.
Mm,
You have to
mm,
introduce. While you are pregnant itself, you have to eat each and every vegetable, even if you don't like,
mm,
because the baby will have that liking from the when they are inside your stomach itself. While
mm.
eating carrot, also you should communicate with the baby. Tell that,
Oh,
see,
carrot is
I'm
good for
eating this
health.
carrot. This is very orange color, very beautiful, and I'm eating this. Your
Mm,
skin will be very glowy, and your eyes will be very big. You will have a very good vision, good, beautiful hair you will have. And I am eating that brinjal, this okra, it will develop your brain and all. And this milk is very good for your bones. So that's why I'm taking extra milk. I am walking on this lawn, and it's very beautiful around. These crows, parrots are there,
mm,
doves are there, and you have to introduce each and everything in your routine life, and so that they see from inside and they will hear from inside and they will understand everything. It will
mm.
be very familiar to them once they come out. They don't
Mm.
feel new. Our languages also, if you
Language.
learn some new languages, it will be like a
Mm.
revision for them.
Oh.
They will very easily they will grasp it. You just observe
Mm,
otherwise,
mm, mm.
then you will know. Immediately they will pick up, immediately they will repeat and recite languages or anything, any talent you, if you want, no,
Yeah,
dance
even
or
mom learns music.
language.
They also maybe get music in them. Like they will
Yeah,
learn.
yeah,
Mm.
yes, yes, yes.
Mm. Thank you, ma'am. Like it's
Yeah,
Thank you.
always like first session. Also, we enjoyed it so much. Lot of wisdom. Thank you very much. The spiritual.
these things, no, actually not the theoretical things. I observed in my patients, and I
Mm,
did practicals also. So
mm,
they worked out very well. They have taken
mm.
the advice and they practice it next time. So they got good results.
See, I delivered, I had my kids in USA, like in 2002, one child, and 2008, one baby. That time it's winter here. It's
Oh,
a lot of snow outside, and my parents came from India and they are not comfortable and to
yes.
adjust with this. They're trying to help, but they themselves they are struggling to adjust
Not as much they could.
and
Yeah.
not knowing so many things. It was like a nightmare with so many things. Emotionally they are not happy
I
also.
understand. Yes,
And
yes.
yeah, but
Yeah.
yeah, that challenge is always here with us, a lot of mothers. But this
Yes.
having this education will help. That time I don't know anything and my mom doesn't know how to help here, but with this knowledge definitely it will help young mothers here. they will be prepared with so many
Yeah.
things.
If you are physically and mentally ready and
Mm.
prepared, yes, you can handle.
Handle,
Slowly
yeah.
you plan and
Mm.
handle things.
Mm.
Of course,
Mm.
each child is unique. You
Yeah.
cannot just generalize them, no. Each
Yeah,
child will have
actually, ma'am, I
their
had
own character.
gestational diabetes for my first baby, gestational
Okay,
diabetes, but not for the second one. And
good.
my,
Very good.
yeah, so the doctor was asking me, what did you do different, and how did you manage to uh, not
Yeah,
get second time? It's you most likely to get because you're older,
yeah.
and I
You
was
manage
doing.
your weight and diet, maybe.
Hmm? I was working that time for the first baby time. I was sitting at home, and
And
um,
knowing, having that awareness that I had gestational diabetes for the
gestational
first
diabetes.
baby, so I
Um,
should not have the next time.
say
Let
second
me
time.
avoid it. That awareness you had, no, that's
Yeah,
why
yeah.
you got to for that. So
Yeah,
so only.
and the doctor told me that my first baby is like in every week in the last trimester they were checking the weight of the baby, and
Yes,
they
yes,
said
last
like
week.
if the baby is more weight, they said it is very difficult to have a normal delivery, and
Yes,
they induced pains estimating the baby's weight.
yes.
Um, yeah, so they said like okay, 36 weeks, their lungs will be fully developed, and let's induce the
So they
pain and
won't
we'll
wait.
get the
They won't
baby
wait for the
out.
full term. Yes.
Yeah, that's what happened for my first baby. And the second baby also came around that time only, but it's a natural pains.
Oh,
Um,
okay.
yeah, so for me that induced pains, it was like they asked me to come, and then my mom was telling, no, now the time is not good. The stars, you need to wait, and that confusion
Yes.
was like
Yeah.
for me so stressful for me and my husband. But then we went with the doctor's word because I cannot wait one more week if the baby weight becomes more. And she said, you might have to go through cesarean. So then I, I didn't listen to my mom and did that thing.
That means you
So
had
I'm just sharing this because it's recording and somebody will get benefited from this experience.
yes, yes, yes.
Yeah,
It's true. It's true. It's true.
yeah.
Nice.
Yeah. And how old are you now, anyway?
And now I am 49 almost. My
But
son is, yeah.
also there are chances that you will become a type 2 diabetic or something like that.
Yeah,
So,
yeah. I'm type 2 diabetic now.
rate, have good physical exercise, at least walking, and
Mm,
eat less of carbs and lot of vegetables and fruits in there. Take
mm, mm, mm.
and high protein diet. This is my advice.
Oh,
So
thank
that
you.
you don't become, you don't turn a diabetic.
So, and another question for me, like if a mother has a diabetes in pregnancy, so normally, like when the child becomes like a certain age, they usually get diabetes, like genetically, like.
No, no. If it is established diabetes for the parents, there
Mm,
are chances that the child will get diabetes. So you manage the weight of your children and junk
mm.
food you don't give. Give them healthy food only.
But it is not that.
Excuse me. Sorry,
She
your
means to
baby is
say
not obese, huh?
No,
Whatever
no,
tell
no.
you.
If is there any connection? Like if mother is gestational diabetic, then only baby
Yes,
get.
yes, yes. Yeah,
Okay.
yeah. There is a possibility.
Mm.
Chances are there.
Mm. And the first baby was like he had a formula because the transitioning to the he was not latching on, and I had feeding issues, and then he didn't, I couldn't continue feeding him. But with the second baby, I did feeding until 2 years. But
Okay.
my first child was chubby, and whatever food we give, the second baby was very lean. And then my daughter, the second one was a girl child. She asked
Okay.
why brother is chubby and why I am like this.
No,
Now they
no,
are
the
older,
metabolic
right?
rate also counts. Metabolic rate also counts. The genetic factors also count, and genetically they will have the fat cells. No, the size of the fat cells will be large in chubby people.
Oh,
Yeah,
okay. So
so
is it
doctor will
because of
personally.
gestational diabetes? I was thinking like, oh, my doctor told me with the gestational diabetes, your baby will become huge. Maybe that is the reason he became chubby or something. I
No,
don't know.
when he comes to his teenage, no, he will
Uh,
become tall and grow, no.
uh,
During that time the hormonal changes also come for the girl
mm,
also and for the boy also. During that time especially you should manage in their physical exercise and nutrition, and
uh,
let them avoid all the junk food and high fatty foods and oily foods and carbohydrates. You have to cut them and
mm.
give high protein diets and vegetables and fruits and dairy.
And yeah.
Nice.
Thank you very much, madam, sir. Your very valuable suggestions. Even though
Thank you so much, madam.
it's been long time, I remember every detail, and I want to help someone with this information, if it's some experience of mine. Thank you.
Thank you so much, madam.
Even afterwards, also, if you have any doubts, you can put in the group so that I can answer.
Sure, madam.
Sure.
Thank you for your wonderful knowledge. I'm
Mhm.
sure many people will benefit.
Hope so.
Yeah.
Yeah.
We hope to see you again, madam,
Yeah. See you
Sure.
again, and
especially with the rearing the children.
mm,
Yes. Yes. Sure.
mm.
Thank you so much, madam, for
Yeah,
your
in
wonderful.
this electronics world, we don't have experience. We
Parenting is
always
another
think that if mother has some work,
skill, very skill. Yeah.
mm,
And rearing up children. That parenting is very tough nowadays.
mm,
Yeah.
it's easy for us to leave them with a screen. Like, is they switch on the TV, or even they don't eat, we just put the TV and they will be watching TV and feeding. It will be easier. So we did so many mistakes unknowingly. Now my kids are
Correct
grown
them
up,
now.
but
Yeah. You have to
yeah.
correct them slowly.
Mm, mm,
Gradually, you have to correct.
yeah.
Yeah.
Okay, madam. We hope
Thank
to
you
see
very
you
much.
soon again.
Yeah. Thank you.
Yeah.
Thank you once again for your wonderful time and knowledge. We look forward to seeing you again. Thank you, madam.
Bye.
Can I close the meeting, madam?
Yeah. Yes.